Hi, my name is Sarah Brennan, and I'm a senior here at Monmouth University. I'm a health studies major with the career goal of becoming an occupational therapist. I wanted to take women's health this semester because I believe that there is a lack of education surrounding women's health, and this needs to change. The topic I have chosen for the cross-cultural presentation is female genital mutilation. I decided to compare Somalia and Egypt because these two countries have the highest prevalence of FGM in the world. I chose this topic because I was interested to learn about what it is, how it affects women, and why it needs to be stopped. This is a very serious procedure that is impacting women all around the world. I remember being in high school when I first heard about it and never looked into it more. Now, having the opportunity to learn about it more, I hope to educate others that do not understand what female genital mutilation is and why it needs to be stopped. I would like to note that there are some pictures that may be upsetting, and I want to tell viewers beforehand that there are diagrams and possibilities of razors, knives, and other cutting devices. The World Health Organization's definition is as follows. Female genital mutilation, also known as FGM, involves the partial or total removal of external female genitalia or other injury to female genital organs for non-medical reasons. FGM is practiced from girls within the ages of birth to 15 years old. Many do not understand the term, so the simplest way to understand it is female circumcision. But it is important to note that while female circumcision has cleaning and health benefits, female circumcision has no health benefits for any female. There are many different origins, but researchers suggest that Egyptian mummies routinely practiced FGM 5,000 years ago. There are other recordings of the practice in religious groups like Christianity, Judaism, Islam, and indigenous African groups. In the 19th century, the UK was recorded performing FGM as a technique for managing epilepsy, sterilization, as well as masturbation. Whether a girl undergoes FGM is dependent on their ethnic group, what country they are living in, socioeconomic background. Many countries claim their reasons for practicing FGM is because of social acceptance, religious beliefs, and the belief that it is a rite of passage into adulthood, misconception about female hygiene, preserving female virginity, making the woman marriageable, and enhancing female sexual pleasure. From this list, it is very obvious that this practice is not done to benefit the health of females. This photo shows the four types of female genital mutilation. In type 1, this involves removing all parts of the clitoris. Type 2 removes all parts of the clitoris and the inner labia with or without the removal of the major labia. Type 3 narrows the vaginal opening by removing and repositioning the labia. As shown in the picture, the opening is then closed with stitches. Type 4 involves all three of the other types, as well as pricking, piercing, scraping, and cauterizing all parts of the genital area. This practice affects all women physically, emotionally, and socially for their entire lives. Physically and health-wise, it can cause lifelong pain, excessive bleeding, urinary retention, genital swelling, UTIs, bacterial infections, prolonged and difficult labor, painful sexual intercourse, sexual dysfunction, increased risk of HIV and STIs, scarring, and much more. There are also mental and emotional problems that affect women. The procedure is done without the consent of the female, and they are normally physically restrained. They are given no pain medications or anything to minimize the pain, and is often performed with dirty scissors, razors, broken glass, or anything sharp that they can find. As you can imagine, this is a very traumatic experience. Psychologically, it creates triggers, causes loss of trust between child and caregiver, anxiety, depression, loss of confidence in the self and caregivers, and sexual dysfunction. Tying into emotional effects is the social effects. In some cultures, women are taught that their bodies mean sex, and sex is a sin. They end up believing that their body is a curse. On the left are signs that a female might undergo FMG. This includes talk of a special occasion or ceremony where the girl is becoming a woman or is preparing for marriage. A relative has undergone FGM, there is an unexpected or long absence, or the girl has plans to run away. Mind you, this is very hard to notice because that there is a lack of education surrounding the topic. On the right are signs that a female has undergone FMG already. She shows signs of difficulty walking, standing, or sitting, complaints of pain between the legs, longer bathroom trips, suddenly quiet, anxious, or depressed, mentioning someone did something to them that they cannot talk about, or avoiding regular doctor examinations. With the lack of education and talk of this topic, many do not realize the prevalence of it. More than 200 million girls and women have already undergone FGM. There are about 3 to 4 million girls currently still at risk of FGM. The practice is recorded in at least 30 countries, and in one study, 66% of the women reported that the main influence or cause of FGM was because their mothers had it. Married women are more likely to be circumcised compared to an unmarried woman. Three-fourths of women believe that FGM could be stopped and prevented with proper health education. There has also been a huge movement with girls, women, and even men all agreeing that FGM should end. I want to bring your attention to the photo on this slide. This shows what percentage of the female population has undergone FGM. It ranges from 0% of the population, like Uganda, to 99% in Somalia. To discuss mortality and morbidity rates, FGM attributes to 11 to 17 per 1,000 infant deaths in deliveries. FGM causes longer labor, greater injury, postpartum hemorrhaging, causing the baby to get caught in the birth canal, low birth weight, and stillbirths. There is also a high possibility for infant resuscitation, early neonatal death, and extended hospital stays for both the mother and infant. For the mothers with FGM, especially types 2 and 3, they face a greater risk of dying during childbirth. FGM contributes to at least 2 extra unnecessary deaths per 100 deliveries. So are there prevention and treatments available? There are reconstructive surgeries available for women who have experienced FGM, but the surgery may not be right for everyone. There are 2 different types depending on which type of FGM cutting the female had experienced. Defibrillation involves reopening the vagina. Clitoral reconstruction involves attempting to restore and rebuild the affected anatomy with new techniques and technology. The surgery will be painful and recovery could take up to a year, but after the surgery, women can experience the return of color, sensation, and sexual function. Preventions include challenging the reasons for why FGM is practiced, change tradition, provide education to women and children, speak out about the risks of FGM, speak out about how no religion demands FGM, and more. There are also many organizations fighting against female genital mutilation and working to end the practice. Now that you understand what FGM is, I want to discuss 2 countries that have shown the highest prevalence in the world of FGM, Somalia and Egypt. Somalia had reported that 98 to 99% of their women have experienced FGM, while Egypt reports 92%. In these next few slides, I will be discussing the demographics of each country. Overall, in Somalia, the whole healthcare system is weak, lacks resources, and unequally distributed, especially by gender. Somalia struggles with drought, high food prices, and war conflict. This has led to more than 80,000 people being displaced, which about 70 to 80% of that are women and children. This does not allow women to live healthy lifestyles or have access to healthcare. Somalia also lacks vaccinations, which causes measles to run rampant, minimal access to clean water, and not enough healthcare workers. All of these factors, along with a high prevalence of FGM, contributes to poor health of women in Somalia. Egypt also has poor healthcare systems due to the lack of funding, poor staffing, and a lack of government support. There is significant difference between the availability of healthcare depending on where the individuals live in the country. They have severely outdated technology and treatment, inadequate training, poor sanitation, and citizens will often refuse to go to hospitals. There are private facilities, but many cannot afford it. On a positive note, Egypt does have 24-hour service pharmacies that provide deliveries to those that cannot get there. Egypt also has the highest prevalence of hepatitis C in the world, along with tuberculosis and rabies. So in all, these contributing factors, along with FGM, cause poor health for women. Continuing, Somalia's current population is about 15.89 million. It is predicted that in 2099, their population will reach about 75.03 million. This is because Somalia's population growth rate is 2.92% and still increasing. Somalia's fertility rates are incredibly high at 6.12 births per each woman. Geographically, Somalia is mainly desert, has year-round hot climate, strong winds, and irregular rainfall patterns that greatly contribute to drought. Egypt has a population of 102 million people with expectations to double by 2078. Their current growth rate is 1.94. Egypt's fertility rate is about 3.3 births per each woman. Geographically, Egypt is also desert but contains low mountains as well. The summers are heat and drought, and winter has little rainfall. Seeing trends in population growth is important because intense growth like this leads to many effects on health. A few examples include lack of medical care and the decrease in livable areas. This is the same with climate and geography because weather and location greatly affect water, access, and food. All of these factors contribute to women's health. Somalia has a federal parliament system of government with a president, cabinet, and prime minister. Somalia is incredibly poor, has low political stability, great amount of debt, and a fragile government system. Constant civil war has destroyed the stability of the government and has now caused many problems for citizens of Somalia. Recently, Somalia has ended civil war and is now trying to rebuild. But the civil war, instability, and debt has caused many strains on healthcare, especially for women. Egypt is based on a republican system with a semi-presidential system of government. Similar to the US, the president is elected by the majority vote and serves a 4-year term and is entitled to a re-election. Egypt's economic system has very slow growth that is affecting their healthcare reform. The nation has implemented different healthcare policies over the past few years, but until they can improve their economic system, there will not be much change. Like Somalia, this block in improving healthcare is detrimental to women. Moving on to societal and environmental factors, Somalian culture is very family and community reliant for the support and meeting of essential needs. Somalia stresses community interdependence. Everything is shared among the immediate family and community. Because of the community's influence, they are very social, friendly, and open. There is heavy belief that personal honor is linked with the family reputation. Therefore, individual reputation does not depend on power and wealth, but how one acts. One big mistake could bring shame to the family. So therefore, families will make group decisions. This, with the combination of family reputation, causes many women to undergo FGM to maintain the good status of a family. In Somalia, FGM has been deeply rooted in the culture for generations. Similar to Somalia, Egypt is interdependent and looks to the community and culture to hold them together during tough times. For example, their economic struggles. Their environment is also very interdependent and cannot be considered separate. As for FGM, there is a very strong social effect, and many households will continue to follow the practice because they seek the approval of fellow peers. to discuss educational and religious factors. In Somalia, educational and religious factors greatly influence each other. In Somalia, only 30% of children are in school, and only 40% of that are girls. The reason these numbers are so low is because of FGM. FGM causes extended leave from school while girls recover. Also, since FGM is performed in unsanitary conditions, more often than not, it leads to infection and major discomfort, which can lead to withdrawal. It must also be mentioned that FGM leads to young marriage, and because of this, they withdraw from school to take on the role of a wife. Somalia's constitution has declared Islam as the main religion, forbidding any Muslim to convert to any other religion. In the Muslim religion, they are told that Allah will never accept them if they are not circumcised. Therefore, families continue to pass the practice down through generations. In Egypt, about 90% of the population is Muslim, so they follow the same religion as Somalia. The other 10% is Christian, but they also believe in FGM. It has been noted that there is a steady decline in the population and popularity of FGM, but more so in the Christian women. In Egypt, a large number of girls will not finish school because of young marriages that follow. In regard to schools, studies show that 64% of girls above the age of 9 cannot read, but Egypt is working towards decreasing this number. However, they have put $1 million to decrease the number, and it has still increased to 92% for women. Boys went from 80% to 94%. Clearly, it is not just the female population being affected, but serious change needs to happen. Education teaches power and encouragement. I would like to point out a few statistics regarding the two countries. Listed here are the world ranks, prevalence of FGM, infant and maternal mortality rates. As you can see, Somalia has much higher numbers in everything. This has to do with the development of the country, economy, education, culture, and how strictly they follow their religion. But higher numbers are not better. As it can be seen, Somalia has a lower world ranking, which is influenced by many factors. Even though Egypt is only slightly above them, it causes significant differences. Somalia has a very high fertility ratio of 6.7 children per each woman, but there are high levels of mortality, sexual gender-based violence, high levels of rape due to war, STIs, displacement, and neglect. Somalia also has the lowest contraceptive protection prevalence in the world. The average life expectancy for a woman is 59.13 years. In Egypt, the life expectancy is much higher at 74.35 years for women. The fertility rate is 3.28 per children per woman. This can be associated with world rank, care, and other points discussed prior. But women in Egypt also face sexual harassment, rape, poor access to sexual and reproductive health care, chronic diseases like diabetes and Hep C. Both countries have such poor women's health because of the lack of education, political power, war, and lack of development in each country. As emphasized before, FGM has been deeply rooted in both cultures for generations. It is also deeply rooted in their religion, even though their religion never specifically says anything about FGM. In both places, their culture believes that FGM is to control women's sexuality and protect them until marriage. Society deems women unworthy to marry if they are not. In Egypt, they believe that female circumcision guarantees good manners and behaviors. If not, bad behaviors and shameful sexual behaviors will follow. FGM is mainly cultural driven. There is nothing in any religion that states that women must undergo FGM, and there is no health benefits behind it. Many women have had the procedure done pass it along to their daughters for fear of being socially outcasted. In the end, these countries are very similar from cultural values and norms. In Somalia, there is no national law in place banning FGM. Back in 2013, 18 religious leaders signed against FGM, but nothing has been done. As of January 20th, 2021, Egypt approved a draft law strengthening penalties against FGM. The new draft imprisoned those that conducted the procedure, regardless if they were medical or not. Anyone that performs the procedure faces 7 years in prison. Doctors and nurses could face up to 10. If the victim dies, the perpetrator faces 10 years in prison, while doctors or nurses face up to 20. In addition, medical clinics that perform FGM could be shut down for 5 years and medical professionals could lose their licenses. Over the years, advocating for women's health has been growing more and more. The practice is declining, and men and women are fighting for FGM to end. In some studies, it shows that more men say that the practice should be ended than women in certain cultures. If you look up organizations fighting against FGM, there are hundreds of them. They are bringing awareness to the situation, building support groups for past victims, pushing the importance of women's health and education, and so much more. Listed below are just a few of the different organizations that are going against FGM. To discuss the what ifs that would arise if action was taken in these countries to end FGM. Ending FGM would give girls controls of their lives. FGM has a lot to do with power and control, and this robs millions of girls of their everyday lives. Many receive no education, have poor health, poor access to health care, face abuse, and not able to meet their true aspirations. Ending FGM would empower girls and change communities, societies, and culture. These girls that once had no voice would be able to have theirs and make a difference. From this presentation, I hope that everyone was able to learn more about female genital mutilation and the severity of it around the world. I want to emphasize that 4.16 million girls and women are still at risk of this practice, and at least 2 million additional girls and women are at risk because of COVID-19 at-home orders and regulations. Just because we are not aware of it does not mean that it can't be happening in the US, because it is. We need to make a change, not only regarding FGM, but women's health around the world and in general. It is a big step towards that will end something like FGM.